I'm going to introduce our next speaker, who also unfortunately could not be here today. So this is also going to be via virtual. And this is Dr. Mark Lavallee. Dr. Mark Lavallee, I'm sorry, is a board certified family medicine and sports medicine physician with extensive experience in clinical care and athletic medicine. He has served as Chief Medical Officer for the USA Weightlifting team and is a member of the International Weightlifting Federation's medical community. He also, which is not just written down here, he's also been serving as a head coach on the US Olympic weightlifting team. So pretty big deal. His clinical interests include musculoskeletal care, sports injuries, connective tissue disorders, and obviously Ehlers-Danlos Syndrome. And he himself is also a patient with classical-like EDS. So this is Dr. Mark Lavallee.
Hello, can you hear me?
Yeah, we can hear you loud and clear. Thank you. Just tell me next slide and I'll make it happen.
Okay, thank you. That beautiful introduction, Ina and Thacker and everybody at UVA. I apologize I can't be there today. Today, I'm still in the operating room. I just finished a case about a half an hour ago. So I apologize, but it is an honor to be among so many knowledgeable people. I like Linda Bloomstein's Bendy Bodies. So there's a lot of learning and cross-learning, and I just feel honored to be just part of your experience today. Next slide, please. So, financial disclosures, we always have to have this. I do stuff with the exercises medicine, and I have an LLC, Flexible Health. But I want to quote Abby Phillips and, her quote yesterday, rare is real. I sort of like that, just like with the zebras for EDS and all the other stuff we have. You may not see us, but we're there, right? So people with EDS, people with the rare forms, the not rare forms, we're all in this together, which is awesome. And we'll talk a little bit more about Abby later. Next slide, please. So I thought I'd put a couple slides, 3 or 4 slides about my journey since I am a person with EDS. And back in the day, I'm 58 years old when before the EDS National Foundation was started in 1987. At the time I was in college, as one of the initial members of that organization before it joined with the British group in 2015. So I've known. I actually had a sore throat in 1973, and my pediatrician read Peter Byton's paper like the night before. So I was very blessed to not take the 13, 15, 30 years. I was diagnosed at a very young age. And growing up with classical type, it was obvious I had something wrong with me. I've been wheelchair bound 3 times in my life. First time was I got gangrene in my right leg from a very bad injury. When we lived in Newfoundland, Canada. I didn't walk until 3rd grade. I was told I was never going to be able to walk. Numerous times, starting at 5th grade, I was never going to live past 40. That was told to me so many times because they didn't know. They just thought everybody with EDS had aneurysms. That's how far we've come. Okay, and they wanted to put lag screws in my shoulders. They wanted to cut my kneecaps off. It was paddlectomy. So their way to fix dislocating kneecaps back in late 80s was to do a paddlectomy. Actually cut your kneecaps off and sew your quad tendon to your patellar tendon. Okay. They took me out of all school activities. And I'm 5'7". I went up to 230 pounds. This is a picture of my son's young adopted sons. My son on the left-hand side is Tommy. He is from Thailand, and we adopted him because he was considered unadoptable. Yeah, he had Ehlers-Danlos Syndrome. Next slide, please. So my personal interest changed when I sat next to a gentleman by the name of Brett. I was morbidly obese. I had scars. I was dislocating. I was depressed. Life was not good at the age of 20. I was at Penn State, and the guy that sat next to me every day in organic chemistry was a bodybuilder. You want to talk about feeling bad about yourself? The guy that sits next to you has got muscles coming out of his earlobes and got, 5% body fat. I can't even get little bendy table in front of my big fat belly. So long and short, he started training me, you know. He said something, he said, well, why don't I help you get in shape? I said, no, you don't understand. I got this condition. And Hopkins told me I can't exercise. And, you know, and he just said one phrase that I will never forget. He goes, how's that going for you? I realized it wasn't going well. So he helped me eat better, slowly exercise. I couldn't bench. I couldn't do a sit-up. I couldn't do a push-up. I couldn't do a pull-up. And slowly things started. I lost weight. And I can definitely say since I started this journey, I have not had any large joint dislocations. I had 20 left shoulder dislocations and 13 right before the age of 20. Less joint pain. I won't say no joint pain, but better joint pain. Then I started working out. Then I started competing. Then I started with USA Weightlifting and then moved on through that over the years. Got to do some stuff before the Tokyo Olympics. And then something really changed. Next slide. A big hiccup. And just a week before the Tokyo Olympics, when I was supposed to be their chief medical officer, I ruptured my quad tendon on the day before 4th of July. Got it repaired by one of my partners on the 4th of July. Within 5 days, I got the flesh-eating bacteria, and you can see what happens when the flesh-eating bacteria eats your whole leg up. And that's my left leg with apparatus. So no one is not too squeamish. And once again, that will be the third time I'm back in a wheelchair in my 50s. Thought I was never going to walk again. By the way, it ate up my heart valve, so I needed my heart valve fixed a year later. And then literally a month before the Olympics, my left lung started filling, left lung started filling up with fluid. I needed to have a chest surgery. You can actually see in this picture, I took my shirt off. I am wearing clothes below that, but you can see a chest tube sticking out of the side of my chest. And that was removed just 9 days before I got to go to Paris. Next slide. So what was the prize? I filled a dream of bringing my kids, now adults, and being the chief medical officer for Team USA and for the Olympic venue. So caring for everybody. Despite having most of my leg removed and my calf muscle has replaced my patella, I can walk upstairs, I can climb, and much to the chagrin of my ortho trauma surgeons, I've even been able to back squat 315, which is lower than I did prior to this, but still with someone with EDS, I look at that as an accomplishment. Then I decided, even with a bad heart valve, can I start and do something crazy, swim 100 miles? Now, you don't do that in a day. It took me 14 months, little by little. Why do I share this journey? Is we with EDS people with EDS are told day in and day out what we can't do and what we shouldn't do. I've taken a different approach of let's try to figure this out. Let's partner with our patients and get them to be the best versions of whatever self they are. So next slide. So EIM is exercise is medicine. So this has been going on historically forever. 500 years before Christ in India was the first known physician, Surutra, who noticed every day should be taken and only half the extent to his or her capacity to move, okay? Otherwise, not moving could prove to be fatal, okay? And this is a artist rendition of Husatra. Sort of looks like Kenny Rogers, if you ask me. But anyways, it was then mentioned by Hippocrates, Herodotus, and Diocles in ancient Greece. Then Galen, famous physician, Roman physician, Cellus, and Asclepius during the Roman Empire. And then we fast forward from all these things that our ancient predecessors knew that movement was important. Ancient Greece started the Olympics, right? They knew something about the importance of movement and exercise, okay? Then 2007, AMA, American College of Sports Medicine, and the Office of the Surgeon General all launched the modern exercises medicine. So next slide, please. So going back, they did the study. They looked at all these different ancient civilizations. They mentioned Yellow River in China, in India, Greece, and then the Roman Empire, all of which mentioned from breathing exercises that exercise should be done daily. Wow, what a unique thing. And as we get further and further into modern medicine, and more of us are living on these little black boxes called cell phones, this, I think, it becomes even more important. Next slide, please. So this is my good friend, Bob Salas. He's a family physician, sports medicine physician out of Fontan, California. And he came up with the term exercise is medicine. And this was in 2007. And then he partnered with, obviously, Arnold Schwarzenegger, who's pictured there. And that made it all the way up to the Presidential Fitness Council, more stuff about, how important movement and exercise is. Next. So what evidence is on exercise as medicine? So I had a chance, I gave a talk 6 years ago, and I went on PubMed and I just typed in exercise as medicine and got 134 hits. I did that 2 days ago and got 244,000 hits. So just in the last 6 years, there's been 110,000 more publications in 6 years on the evidence that shows that exercise is a great part of medicine. Okay, so we won't go into all that, but basically exercise and movement. Okay, now we're going to get into today, the weeds is EDS patients are unique and they're different, and not everything works the same, and we need to adapt. We've come up with a bunch of adaptations for even my sickest EDS patients that are bedridden, that are on TPN or have central lines. We have been able to figure out how we can get them stronger and more fit. Okay. There's not been a patient that I've said, you know what, you can't do this. We just have to figure out a way. Okay. Next slide. So what are we going to talk about? We're going to talk about some health issues, barriers to starting. Okay. And when I bring this up, there are some EDS patients in my EDS clinic and Marfan clinic. They have lots of barriers. Some look at their barriers as challenges, and some look at their barriers, especially after the challenges they've had in modern medicine, that they may be insurmountable. Okay. Then we'll go over assessment. We'll go over how to put a personal exercise plan together. I realize that I'm speaking both to physicians, PTs, personal trainers, patients, and caregivers today. So I'll try to make it so a little bit of everybody gets a little something out of this. We're going to talk about how to start an exercise program like in bed for 5 minutes. If I can get someone to commit to 5 minutes in bed a day, that's the start. And then we work through cardio, strength, balance, and flexibility. And then logging, we got to measure. We have to set a goal. We have to measure those goals. That's part of academics. And I think it helps people realize, hey, you don't think you're doing better, but here, look at these numbers. You are improving. Okay. And lastly, how do we use this as physicians and caregivers in a professional setting? Okay. Next slide, please. So barriers to starting exercise. This may be starting with your primary care provider, whether that's a chiropractor, a pediatrician, doctor, whomever. Too much pain, too fatigued, too lightheaded, too many meds. I'm on TPN. I'm on Hyperal. I'm this, that, whatever. Those are all barriers. Okay. But I call those starting points. Okay. And, I had the opportunity to get to know Abby over the last month and a half when she knew I was going to be at the Arnold Classic in Columbus. And the Courtney Gemsner introduced us, and she is an amazing powerhouse at 4'11". We vastly connected because not only are we strength athletes, not only do we have a passion for what we believe in, we both have classical type EDS. And I'd never met on 58 years on this planet, I never met a strength athlete as serious as I used to be with classical type. So we were just like kindred spirits. I think she coined the term stretchy besties. Still makes me laugh. Obviously she's got a presence on social media, but I look at her, I got to watch her break a world record in the parrot bench on the 7th of March of this year. She benched 70 kilos. The previous world record was 60. Okay. Here's someone who just had foot surgery. Okay. Goes out there with a smile on her face and is just impressive. People don't realize, I can say this as a physician, and been very honored to care for over 9,000 patients with EDS in my 30 plus years as a doctor. I get to see some pretty horrible stories, but I also get to see some pretty successful ones. And if I had more time, I would share them with you. Another thing people worry about is lack of knowledge. They're going to hurt themselves, and then motivation. I spend a lot of time motivating because there's a lot of things. Those are all the barriers. Okay, next slide, please. So this is, like with everything, there are sheets that you're going to see that I put on that you guys can copy and take out of my slide deck that are published by AIM, Exercises Medicine. When you're talking to a family member, your caregiver talking to a patient, your doctor talking to a patient, where are they? This is the same thing we do if someone's a smoker and we want to get them to quit. There's pre-contemplation, contemplation, prep, action, maintenance, right? So the same thing with exercise. Next slide. So then once someone says, okay, I think I'm ready to do something. I'm ready to get out of my wheelchair. I'm ready to take my life back. And that's really what I think exercise is. It helps get your life back, okay? Whether you've had a stroke, your breast cancer, or your EDS. Sorry about that. My screen timed out. So once you make that decision, we need to do some assessments, see what you're capable of, and so you don't hurt yourself. So things like injury prevention, like FMS and Y balance, we use for injury prevention. Next slide. There's get started. It's always important to make sure you don't that you have things checked out. Like if you have one of rare forms, arthrochalasia, vascular, if you have Marfan's, we probably want to check your aorta and your valves a little bit more than maybe our hypermobiles, okay? Because they have higher risks. So if you've got cranial cervical instability, maybe you shouldn't take up boxing or mixed martial arts where your head's going to get bopped around like a bobblehead, right? Things like that make common sense, but common sense is not always common. So that's why speaking with your PCP to make sure, or a sports doctor or something like that. Next slide, please. Okay, once again, physical activity, vital sign. Vital signs are important. They tell us, are we going to have a high blood pressure? Is our sugars right? Is our weight okay? Are we breathing okay? Heart rate okay? Well, the more we talk in medicine, someone that's sedentary compared to someone that's active, we want our patients to be active. Whatever that looks like, doesn't have to fit into the norm, but we want movement, okay? Next slide, please. Everybody's different. So here's some other forms that you guys will be able to access from my talk if you want to print them off and use them. But you can go to the Exercises Medicine website and they can print this all off. Also, American College of Sports Medicine have these. So now you decide, okay, are you an introvert, extrovert? You want to work in a gym? You want to work at home in the basement? You want to walk by yourself with your dog? All this is awesome. If you are a people person, maybe you want to do some group fitness. Next slide. Maybe you're doing, the local gym has a cardio thing or love aqua aerobics. Have a lot of my EDS patients in the water for numerous reasons. And finding a personal trainer that might be open-minded. There's some check boxes down here. I won't read it all. Yeah, are CPR certified? Do they look at what your medical issues are? Or do they just some buff dude or gal that just throws you and beats you up and charges you a lot of money? And see if they have certifications. Lots of different ways. Your local sports physician, whether it's a sports chiropractor, sports ortho, or sports med, can usually help you find someone that has a little more of a medical basis. Okay, next. So now we're going to develop your own exercise program. So how do we get started? Start with goals and rewards, okay? If we don't have a goal, we're not working towards anything, okay? I always say, they say, well, I just want to not be in pain. No, those are small goals. They're real goals, but let's go bigger than that because most people, once we start a good exercise program doesn't hurt us, we will release endorphins and enkephalins. Some people call this the runner's high. Teaching my patients to unlock that, the natural opioids in our brain is key because then they will have less pain. So that is a portion of what we teach them to do. Partner with your family, kids, pets, have a friend. If you have someone that holds you accountable, okay? And then start small. We always start small because, EDS, when patients with EDS, myself included, we want to do everything. We're gung-ho. We overdo it. We get injured. That just makes us more depressed. And like, I can't do it, right? So we got to start small. Next slide. So a couple things, realizing I was showing the same exercises and things. I started an LLC. It's non-for-profit. I have a QR code here if you'd like it. And the issue is I had to start with something that my most severely affected patients could do. And I figured, well, they all have a bed. Most of them. I have a couple of homeless people that live in their car, but most people have a bed. Okay. And if it's not a water bed, which sort of went out in the 70s and 80s, if you have a normal bed, you can probably do this. Okay. It starts off with 5 simple exercises. It takes less than 5 minutes. Okay. Crunches done a certain way, not to hurt your back. Static leg holds, flying Supermans. Anybody that's been through physical therapy probably have done some form of that. The QR code, I had one of my personal trainers, I videotaped her demonstrating it because they all go, don't you have an Instagram account, Dr. Lavallee? And I'm sort of like Thackeray. I am not social media savvy. If you even look at the website, it has my son's name because he had started under his name and not mine. Okay. So you go, if you want videos, those are your link to videos. Next slide. That's what it looks like. You see these things called core exercises. We have to start with the core before we work on other parts. Okay. A lot of issues with the core, a lot of issues with limb, upper limb, lower limb, dislocation, subluxations. If we get the core as our center starting point and work from there, that's where we're going to go. Too many people just say, I'm going to start a walking program. Well, wait a minute. There's going to be issues with EDS in that. So we start very slowly. Next slide. Okay. Next slide. Okay. So once we start the core and we seem to have some success, we follow that. It's done every day for 5 minutes. Now we can start thinking about cardio. Things like my big thing is, well, I'm in a wheelchair. I can do this. I can do that. I do a lot of aqua. I said, if someone has had drowning experience, or fear of water, this won't work. But even someone that is a horrible swimmer, we can keep them in the shallow end and tread water. Treading water for 15 minutes is equivalent calorie burn of jogging for 45. Okay. So, I don't recommend jogging for at least in the beginning for a lot of patients because of the amount of force it puts on the joint. If they get to a strength level, then we talk about that. So cardio, lots of different ways to skin a cat on when it comes to developing cardio program. I just use aqua as a great starting point for those who are more severely affected. Next slide, please. Strength. Okay. Obviously, I hang out with people that are very, very strong. Okay. Thorn Bjornsson, here he is 6 years ago at the Arnold, breaking a record. If you don't recognize Hawthorne, he was the guy in Game of Thrones. Okay. Very strong gentleman. Very tall gentleman, 6'8", 375 pounds. This is Lasha Talakadze. He's from country Georgia. This is us in Paris, where he got the gold. He did not break he did not break the world record, but he got a gold medal lifting weight over his head, 570 pounds. But that's the extreme. I am happy if I can get a patient to lift a 2-pound weight, okay, over their head and not dislocate their shoulders. We set goals just like these athletes set goals. And we sing praises for even the smallest success, because we don't hear that enough as EDS patients, that we did something right, that something's making us better. Next slide, please. Balance and proprioception. This is a huge issue. Some of it's muscular related, because of deconditioning. Some of it's ligamentous related. Some of it's neurologically related or mediated. So finding out what the problem is it the joints, the muscles, or the nerves, and then fixing that problem, okay? Addressing that problem and then working on it. Things like you don't have to be like the gentleman on one arm, okay? Though there's many of my patients were gymnasts, cheerleaders. Then they went through puberty and the wheels fell off the cart. So they have abilities. I have an Olympic She was on the Irish Olympic weightlifting team. I met her in Barcelona at a World Weightlifting Championship where she was coaching at 31 years old. She had been in a circus performer in Europe before she became an Olympic weightlifter and diagnosed her with EDS, right? So they're all around us in all different walks of life. Cirque du Soleil did some work with them. They all have a bite. Literally everybody has a biting score of over 5. Does that mean all 124 performers have EDS? No. Some have it. I would probably say 25% in this one particular instance that I was privy to. Okay. But there's a lot of going on out there, and balance and proprioception is important. Next slide, please. Flexibility and stretching. Okay. Here's Simone Biles. She has a biting score of 9. Okay. Does she have EDS? Can't say. Doubt it. Right. I'm not privy to say. I'm not her doctor, but she does have a biting score of 9. I know that for a fact. Plyometrics. Is the next slide, please. The slide for Nordic hamstrings. You can click on that and see it later. But our biometrics, this is how if we don't measure it, we don't know if we're improving or getting worse. So there's all sorts of things. Wearable devices. I do not have any financial stuff with Apple, Fitbit, or smartphones, but I put examples that a lot of people are using. And there's all different things, like they can be waterproof to do swim distance, pace, log your exercises, calorie counters, communicate with another person on the same app so you can race each other. It's pretty fun what you can do with some of these things nowadays. Your smartphone can also be a great tool for steps. Almost all the smartphones now can do a step counter, just as long as you keep it on yourself, which most people do. And last, for old geezers like me, there's Exercises Medicine has a form that you fill out, what you're doing, per week, log books, pen and paper. Next slide, please. Next slide. Logging your success. We'll skip over this slide. I should have decided. I should have deleted this slide. Next slide, please. Using in clinical practice, this is for the clinicians, because I think, there was a time when we weren't reimbursed for talking about preventive medicine and wellness and diet and exercise. Now there's some codes out there. There's a lot of things we're looking at: physical, psychological, emotional, sexual, spiritual, medical, sleep. All these things are the different facets of the diamond called the human experience. And I think we as clinicians, a lot more people in functional medicine, family medicine, pediatrics, get this in the sense of it's not just about being strong, muscular. It's not physical. On any given day, someone can move more weight or less weight. That's between their ears, not between their muscles. Okay. So looking at all these different things going on, and listening more than talking, just being present sometimes can be so helpful for patients. Next slide. I wanted to sort of pull this all together. Those of people that are in EPIC, which is one of the electronic health records, there's a whole thing, but you can come back and look at my slide deck later on not only how to access all these amazing resources that you can print off for your patients, both in English, Spanish. They're coming up with German and a couple other languages, but right now it's English and Spanish. Next slide. Next slide, please. Oh, just keep going. I think keep clicking till the next. Yeah, these are all just different parts of EPIC. I thought, okay. The last bit is for those that go back one. Sorry, back one slide. For those physicians, I put in all the different codes that you can use when talking about exercise that you can bill for, and it has RVUs and all that stuff. Very doctor stuff, but I put some tips and tricks on that. Next slide, my summary slide. Yeah. So here's a summary. The important thing is when you're talking about physical activity, we want to encourage things that are easy to start with and build goals that make things more of a challenge. And we got to celebrate and praise their successes and just showing up and trying. There's different expectations at different age groups. The age is I take care of masters athletes. At World Masters, my oldest competitor was 93. Next year in 2027 in the World Masters Games, they're telling us we're going to have over 3 dozen centurions competing. 3 dozen, 36 plus people over 100. So age is only relative. Next slide. So if you need to get a hold of me, that is my cell. If you're going to text me, because I do get some spam, just say EDS Symposium or EDS conference attendee. I will try my best to answer any texts. There's my work email. I work for UPMC, University of Pittsburgh Medical Center. There's a website, QR code. Anything I can do to help anybody, I'm more than willing to. Thank you so much for your time.
Thank you, Mark. Are you able to stay for a question or so?
Yeah, of course. Absolutely.
Any questions for Dr. Lavallee?
They have to use the mic for this.
Okay. Any questions? Yes, question for Dr. Lavallee.
So I know this might be a little bit of a hot take in this crowd, but this is just part of my story, but prior to a spontaneous fracture without trauma, walking in my kitchen, cup of coffee, cup of tea, suddenly my leg's broken. I was a pretty avid equestrian, and I managed to heal a little bit before going back to school. I know I'm already hearing maybe some doubt around the room with horses. They're unpredictable animals, but the sort of feet up approach of having the proprioception and the kinetic awareness. Has there been any studies or acknowledgement of hippotherapy, at all? Like, do we think it's maybe a possible option if there can be a safe horse?
So I can't see you, so I'd have no idea how old you are. Are you young or old?
I'm a whopping 23 years old. So
you're ancient. No, okay. So you're 23 years old. So here's the thing. Equestrian therapy has been shown to be so beneficial. It started with a lot more of the Special Olympians and different autistic populations, but I think it totally carries over to EDS and my other populations that I take care of. So absolutely. Do I take care of, in 2011, I had the chance to be in the Pan Am Games in Guadalajara, Mexico, and I took care of dressage, and that's a whole nother bailiwick. There are certain things, the jumping, if I had bone fragility, I would be, not that I would say you shouldn't do jumping with a horse with bone fragility. We would just have to make sure that we protected the patient the best we could. We used to be, in our profession in sports, we used to say, we're not going to let you do that. Okay. You have hypertrophic cardiomyopathy. We're not going to let you play sports. It's totally changed. It's now joint medical decision-making. The patient, and it's very different than the paternalistic days of just 15 years ago. So I think there's a lot of opportunity. I love the idea of the connection between the horse and the rider, and certain horses, if trained correctly, are invaluable. So I would say, I think there's a lot to be said about what you're doing. Now, step back, why you had a spontaneous fracture, that's a whole nother, thing. I start thinking of a Cole 1A1 defect, which would be osteogenesis imperfecta type 1 or type 2, probably type 2, or type 1, which is not as involved. Because, I do get to see some osteogenesis imperfecta in my practice. So that's like offline. You can email me or text me.
Okay. All right. Thank you so much, Dr. Lavallee. Mark, thank you very much. Okay.
Thank you for having me. It was an honor. Thank you.